Loading. Alrighty. We are live. Okay, hi everyone. My name is Courtney. I am the Development Coordinator at Access Assault Care Center. I'll be guiding our discussion today where we talk about domestic violence through a public health lens. This is the last part of our Domestic Violence Awareness Month Facebook Live series. The last two discussions are posted on our Facebook channel or our Facebook account, so go ahead and check those out if you have not already. Today, as we talk about domestic violence as a public health issue, we have some awesome guests here that all work locally around public health or domestic violence. I can't wait to hear from them. So let's go ahead and get started. Let's go ahead and do some introductions first. Just introduce yourself, your job, and how long you've been in the field. I got mine out of the way, so let's go ahead and just start with Carrie.
Good afternoon. My name is Carrie Geis. I use pronouns she, her, hers. I work in the Office of Student Wellness. I've been in the field of sexual violence prevention and response for about 20 years. I don't know how that number got so high so fast, but it did. I started out in advocacy in my undergraduate experience and have just progressed through there. So I'm still loosely related to the field, but I'm now focused on more holistic wellness and well-being, but still have a strong passion for assisting survivors and for ending sexual violence.
Welcome, Carrie. Monica, you can go ahead and go next.
Hi, I'm Monica Gedkin. I'm the Violence Prevention Coordinator and the Rape Prevention Education Director at the Iowa Department of Public Health. I have been in the movement to end violence for 13 years. I started as a volunteer at Access.
Great. And then Malai, go ahead.
Hi, everybody. This is Malai Amfar from United Way of Story County. I am the Story County Reads Director, so I take a focus of kids programs and education with that education pillar, looking at age groups 0 to age 11 in all of our programming. I'm also a Mid-Iowa Health Foundation Fellow. I've been working in the child advocacy space similarly with one of our colleagues here for 20 years. And when I was thinking about that, that seems like a really long time. Just really started working as an advocate for children with disabilities first, did that for 6 years, and then spent 10 years as a community engagement person developing youth programming, and now have been in my role here for 3.5 years.
Awesome. Thanks, everyone. We have some awesome people here with some great insight, so I'm excited to get our conversation started. Just to start it off for people who might not know, what is public health? And Monica, how about you go ahead and start us off with that one?
Yeah, I'll start with the perspective of what is the public health model. So looking at what our approach is. So we're really looking at the conditions in which we work, live, and play as people. And we look to define the problem. We then identify risk and protective factors, and then we develop prevention strategies and interventions. We test them out and see what works, what helps with improving outcomes, and then we move to the widespread implementation and sharing of that. So really looking at informing the way that we engage and improve the quality of life by understanding public health issues based off of the public health approach.
Great. Carrie and Malai, did you have anything to add to that?
I would love, Malai, I'm sorry, go ahead.
No, you're fine.
It's so hard, you don't know when to merge.
I know.
So I would say for public health, the majority of framework that I use or have used for sexual violence prevention and response is primary, secondary, and tertiary prevention. And the different levels of system level prevention, intervention, and prevention of re-traumatization. I think that framework has been incredibly helpful for me to articulate the need of, yes, as we're working on the big picture of bringing down the numbers for sexual violence, what a gift that we can do some immediate prevention at the tertiary level. So that framework has just always been important to me in the work that I do.
I appreciate that. As I'm learning more about ACEs and trauma-informed care, that's a framework that has been incredibly helpful for me as well. Thank you.
So I've heard people say that domestic violence is a public health issue. What do people mean when they say that? Monica, let's go back to you again.
All right, wonderful. So one thing to pull out from this is we are most familiar with the term domestic violence because back when VOW was authorized in 1994, that was the prominent term that came forward, and that is what's used most prominently legally. You'll see that in Iowa Code, what is domestic violence? But within public health, we refer to domestic violence in a broader term of intimate partner violence. And so depending on where you live in the world and what language is most prominently used, people are more familiar with domestic violence. From a public health perspective, we refer to it as intimate partner violence because that holistically includes experiences of adolescent intimate partner violence and expands that into stalking and other perspectives and experiences. So why is it a public health issue? Because both causing harm within an intimate partner violence relationship and experiencing harm within an intimate partner violence relationship is a life adversity. If you are a child who's growing up in a home where intimate partner violence is present, that is a childhood adversity that happens during your development. If you are a teenager who has a developing brain exposed to intimate partner violence, that is a life adversity. And those life adversity and experiences have known health impact tied to having experienced those adversities, whether they are a childhood adversity, an adolescent adversity, or something you experience in adulthood. Some of those known health outcomes include and are not limited to experiencing chronic disease as an adult, diabetes, anxiety, depression, GI issues, sleep disorders. So these are quality of life issues that there is a profound amount of data tied to health outcomes. So that is a part of why that specific experience of intimate partner violence is a public health issue. Furthermore, well, I'll let I'll let the other presenters expand upon that, but because it is something that's not happening on only an individual level, this is something that is so prevalent that it impacts on an individual, a relationship. It's a part of our families, our culture, and our society. So this is something that needs to be addressed on a community and societal level because it is a community and societal issue. It's not impacting one person. It is so prevalent that it is a part of our culture and our society that we need to address.
Yeah, that's really helpful information. Malaya or Carrie, did you want to add anything to that?
Yeah, I do, because Monica had mentioned adverse childhood experience. And so that's the frame that I'm going to pull from too, because that's what I'm most familiar with. So ACE or adverse childhood experience, there were some things that Monica had mentioned in terms of chronic health conditions. And I have some data that was recently shared from the Iowa ACEs 360 report, their newly released report from this past October. Some of those data linkages are related very specifically to health. So some of that data includes that if an individual experiencing 4 or more adverse childhood experiences in which domestic violence can be considered an ACE or adverse childhood experience, they are 1.47 more times likely to have cancer. 1.88 times more likely to have diabetes. And so on and on these statistics go. There is a chart in the report that shows the rates of those chronic diseases much higher. And so just going off of what Monica said, really supporting the idea that this is a health issue, very well documented, that toxic stress can have some serious impacts on infant health, on childhood health and brain development. And so when we think about all of the people that we're engaging with children, those are also folks that would be impacted by this as well. And so it's definitely a community-wide issue.
So you each kind of touched on it, but maybe if we just want to reiterate so viewers really get the idea, why is it so important that we look at domestic violence or intimate partner violence through a public health lens instead of, you know, any other lens that they could look at it through?
I think I'll jump in on this part. I think for folks watching, my answer is going to be far less academic than the previous answers given. I was listening with attentive ears because those are fabulous answers. But I think when we position the topic as a public health issue, we reduce the stigma of the topic because then it becomes a health issue versus the victim blaming that can often occur within domestic violence or intimate partner violence. So I love the public health approach because I think it invites everyone to the table to have the conversations. It helps folks that may not have a direct relationship with the issue re-engage with the topic because they can look at it as a broader health issue. It helps reduce the stigma for folks that have experienced it because they understand that everyone is engaging in it, in working to reduce it, not engaging in the actions of partner violence. And last, but certainly not least, when we view it as a public health, gender identity is less focused on. So oftentimes when we think of intimate partner violence, we think of supporting the survivor, and we oftentimes stereotypically label the survivor as someone that identifies as female. When we take it to a public health place, it takes those stigmas and those stereotypes away and just looks at the specifics of what are the dynamics and the factors around domestic violence and intimate partner violence versus the stereotypes and biases that many folks have in their heads.
Definitely. Monica and Malai, did you want to add to that at all?
Yeah, I just appreciate that approach of thinking about how it is community-wide versus an individual issue. So just a note that I had made helpful to look at it from the idea of a public health perspective, because there are so many people that are involved within a system, within the community, that the impact that it has on that individual touches more than just that individual. And so the responsibility to help and serve and support the individual, it, like when you look at it from perhaps a social services or a law enforcement perspective, you put that responsibility right on that individual versus the whole community and taking a nice community embrace approach. And so I think just it kind of goes along with what you were just saying and just really underpins that approach with the community. We are all part of that system. And so for us to wrap around our arms around that is just really important.
Yeah, in closing, it's really helpful to think about intimate partner violence from the public health perspective, because we're able to think about the places in which we work, live, and play at a wider community, and being able to think about what aspects of those conditions need to change to prevent and to reduce violence from occurring. So we would look at data and being able to say, oh, what type of organizational policies would be beneficial with preventing violence, lined up with the technical assistance package that's put out by the CDC about preventing intimate partner violence throughout the lifespan. When you look at it and you understand some of the causation, you look at the data, the best data that's available, and you see that a prevalent amount of experiences start in adolescence. You're able to look at, well, when is the best time for us to engage in prevention strategies? What are things we can do in our community? And you know, one example of that could be looking at understanding the health impacts, would be you know, thinking about access to healthcare. If someone is a child who grew up in a home, you know, how do they have access to healthcare? And it is really interesting we can get into the weeds about things, but up until 2008, 2009, there were still 8 states in our country that did not have laws in place to prevent insurance companies from having domestic violence experiences be a pre-existing condition. Those states were Idaho, Mississippi, North Carolina, North Dakota, Oklahoma, South Carolina, South Dakota, and Wyoming. So a public health approach would be able to say, we're going to assure that people have access to health care. One known strategy for preventing intimate partner violence is economic supports to families. So if you're focused on an individual family, that's wonderful. You can make incredible change with that individual family. Now, what are some things on a community societal level that we can implement that is a form of economic supports to families? So you can go through and start thinking about having children and having a tax credit. You can think about living wage and what that would mean. When you look at Iowa and you look at the data, median household income in Iowa in 2018 was $59,955. So when we start to think about income and what does it mean to have economic supports for families to reduce those experiences of intimate partner violence, there are things on a community level that we can change that would reduce the amount of individuals needing individual supports. Social services and law enforcement perspective are hugely important because they are working on how to appropriately respond to. However, if we can work further down the prevention aspect and being able to say, if we can stop it before it happens, and if we can improve the conditions in which we work, live, and play that are in favor of preventing violence, we will have less people needing social services. So that's a helpful aspect for public health perspective.
I'd love to hear from the other 2 of you what strategies, because Monica, you just mentioned strategies you use to prevent violence. I'd love to hear from the other 2 of you what strategies you both use to prevent violence.
Yeah, it's kind of going along the same lines of what Monica has outlined. So within my position and my work, I connect partners with resources. So for me, it's thinking about those resources and trauma-informed care practices that I can push into schools and school districts, connecting with Heartland AEA. I'm also working with nonprofit providers who would be working directly with children. And so ensuring that those resources are available and that we understand what the community need is. Those are the main strategies that I utilize. It's just really making this awareness of what is available for people who are needing services to be able to support it from a community-wide approach. It's just more drawing awareness, talking about it, and just really directly showing people where they need to go for services.
How about you, Carrie?
I would say throughout my career, it has been bystander intervention, right? And it's different models have come to the forefront of that. I started my career working with the Lindsay Bresnack Nuisance program at Central Michigan University that got peers together and talked about what each person can do to end the violence, even before it starts. So it was that bystander intervention model that then sprung into the Green Dot bystander intervention program. I am absolutely in love with both of those programs because they really focus in on what each and every person in the community's role is to change the culture. So with Green Dot, a red dot represents a act of violence. So domestic violence or intimate partner violence would be included in that because it's power-based personal violence. A green dot is any proactive or reactive action that anyone can take that interrupts that red dot from occurring. The part that I absolutely love is that they give different strategies for it. So if you're an introvert like me, you probably won't directly address the situation, but you might delegate it out or you might create a distraction. So it helps, and in my population that I work with, the students and college students, we're not telling them they have to directly address it. That might not be safe for them to do, either physically or emotionally or socially. So that might inhibit them. They might instead delegate it out to their community advisor or their professor. Or they might create a distraction and just interrupt the situation from happening without having to label it. So I think the Green Dot program does a phenomenal job. Dorothy Edwards is a brilliant human and created a great program that really helps folks get around their barriers for why they don't intervene. And then it creates this ethos in this community of, wow, we really can end the violence. We really can end those numbers like 1 in 4 and 1 in 3. Nobody wants those numbers to be as high as they are. So I think Green Dot and the No Ethos program have been fundamental in my work in sexual violence prevention and response.
Great. So I'd love to hear from each of you about your specific role. First of all, do you notice domestic violence in your role? What were the red flags? What usually are the red flags? And what do you do then to address it? Malai, let's start with you.
Yeah, so my role now, I have to go back in my past work career because now I don't really engage that much directly with families and with children. But when I did, I would say that some of the red flags that I saw with kids would be certain behaviors that would crop up when we're doing services, particularly if I'm doing like one-on-one services. Sometimes it would even be child boldly telling me what's going on at home. There could be also some missing of milestones. So for example, there might be some developmental milestones that might creep up. So for a provider that I might be working with, they might tell me about, you know, what milestones child might need to hit and they don't necessarily hit that. So some strategies, I was a mandatory reporter at one time. I'm no longer in a role that requires that, but strategies, you know, kind of going back to what's been said before, just really looking at the individual, what their needs might be, and then supporting them with services in a kind way, really directing that child's family to places where they can go to receive supportive services.
How about you, Monica?
It's a great question in framing red flags or aspects to look for. There are definitely some dominant aspects, whether it be within an individual or family, but looking at community aspects, significances in difference of pay, you know, looking at equal access to components of life that would impact intimate partner violence, access to housing programs. There's a variety of different factors that are more on the community level. Also, in kind of looking at the experiences, reframing into the perspective of acknowledging that intimate partner violence is so pervasive that it impacts immensely. And you may or may not, as a service provider, as a public health professional, as a friend, as a family member, it's not your responsibility to look for red flags. It's important to acknowledge that we do know, like there are things that we know that are like, whoa, those are absolutely something's going on, and to respond to that. But acknowledging that our relationships impact our health and our health is impacted by relationships. And intimate partner violence is something that impacts across the lifespan. So one of the greatest things to do is think about how can I expand my empathy and my acknowledgement that throughout the course of your life, you will know a person, whether it's yourself, someone within your classroom, someone within your workplace. You're going to be interacting with someone, whether or not they share their red flags or they have really high survival mechanisms of covering those things up. It's just important to acknowledge that it is so pervasive that it impacts. And so being able to think about what are the things that I can personally do to influence higher levels of empathy, acknowledgement, and access to higher quality of life for everyone. And then you will specifically impact survivors of intimate partner violence as well. So it is a helpful framework to be aware of red flags because those are an important historical aspect in the the profession of understanding how that is experienced when we look at power and control dynamics, when we look at tactics for how people gain and then maintain power and control within those dynamics, but it happens both within relationships, families, and systems. So that's a really important aspect to take into account. So yes, absolutely. I see power dynamic both between when someone is a part of my family and friends, when someone's a part of my workplace, when I'm out in the world. And so I think that it's important for people to be aware of that because it is so pervasive. Whether or not the red flags are shown, know that you are in the same place as survivors of intimate partner violence.
How about you, Carrie?
I just loved your answer, Monica. I'm absorbing both of your answers, which is so fabulous. It's so great to be with you today. I would say the two basic cornerstones that for red flags, Monica and Malai refer to, which would be power and control, are huge. So any imbalance and how that manifests is different for each situation, but how that power and control manifests. The other red flag is quick involvement. That continues to stand the test of time for being a red flag as well. I want to definitely honor what Monica said about having it not be your responsibility to monitor for those red flags, but also cushion it with, we want you to be prepared to understand if you do see those red flags, where you can get the support, right? So they've been absolutely spot on with the power and control and the quick involvement.
Awesome. So this is a question that I really love to ask. What is something that you've learned in your career over the span of it that you wish the public or the general community knew about domestic violence? Carrie, let's start with you. You look excited.
That's a fabulous question. I got real excited about that. I don't have a very good masking face on that. I would say anybody is capable of perpetrating it, and anybody is capable of experiencing it. And capable might not be the right word, but it's anybody can perpetrate it and anybody can experience it. There aren't factors that exclude you from those things. So it can be the strongest person, physical strong, emotionally strong, all those things. It can still happen. It can appear to be the kindest, nicest, most polite person on the outside, can still be perpetrating it. So that it's the actions, not the guise that the person is wearing, that dictates whether it occurs or not. Because I think we oftentimes look at the outside situation and judge whether something's happening or not, when that's really irrelevant to the case.
How about you, Monica?
I love this question. From the perspective of if I had to choose one thing, really the social consciousness raising aspect. And what I mean by that is really understanding that survivors, when they're experiencing violence, they look at what did I do wrong? Why did I cause this? And it's that individual aspect of why is this the way that it is? The social consciousness raising goes beyond that to be able to say, because violence is so pervasive, because intimate partner violence is a public health issue, it impacts. And I feel that offers so much validation and affirmation to individuals, families, communities, in understanding those perspectives. But the biggest, greatest thing is that there are so many amazing people in this world who want to collaborate on this topic. And whether it be that they are coming to a space of Iowa ACEs 360 and they're understanding the adversities, whether it be that they are in a wellness clinic and they are responding to, acknowledging that everyone who's walking in your clinic, if they're living with chronic disease, if they are having depression, anxiety. Those are behavioral and symptomatic outcomes of exposure to adversity. Someone who's struggling with smoking, someone who's struggling with addiction, if you go to the heart of the matter as to why those behaviors are happening, the greatest takeaway that I've learned in 13 years in this profession is that there are a lot of amazing people in this world who want to collaborate on preventing intimate partner violence, violence in communities, and that's incredibly inspiring. And that's my happiest. If I could focus on anything, it's the ability for collaboration. There's a lot of amazing people out there.
Definitely. How about you, Malai?
Yeah, for sure. I think something that I have noticed just within the course of my career is just how much information there is to be supportive with resiliency tactics. And these are things that are creeping in beyond the health sphere, but entering sectors that maybe hadn't talked about it or thought about it much before. And so that's something that's really inspiring to me, is just seeing how community has really started to come together and understand roles that each of us can play as a member of community or as a member of society to be able to support each individual. There's also a lot of discussion about equity and supports within ensuring that trauma happens. There's collective trauma too. There's community trauma as well, and how we can support each other just as human beings. And so this idea of empathy and connection and compassion, all of these things have really just been uplifted to the forefront, where before it was not like that. And so a key takeaway that I take is that I feel like we are all starting to go on this journey, learning together about how we can best support individuals, regardless of what may have happened, but just asking that simple question of what's happened, what's going on, and checking in and connecting with people versus what's wrong with you, the question before, which was typically asked. So that's something that I can take away. Just we're taking this much more empathic approach with understanding who the human is and supporting with community.
Great, thanks everyone. The last question that I've got for you today is one to kind of end on a happy note, but what's something happening in your community that you are excited about or that you think is really important? Let's go to you, Monica.
Yeah. Oh my gosh. One thing. That's always the hard part. Like one thing, really. So really looking at being aligned with the a technical assistance, a package that's put out by CDC that is a body of data, understanding what works to prevent intimate partner violence. I like the strategy of disrupting the developmental pathways towards partner violence. And the approach to that is early childhood home visitation, preschool enrichment with family engagement, treatment for individuals who are exposed at an early age. So being able to think about the things that we can do, and acknowledging that while we may be experiencing different levels of adversity that impact our developing brains, we have the ability to heal. We have the ability to move forward and to acknowledge what supports are needed. So anything in regards to disrupting developmental pathways, I'm a big fan of home visitation, but really looking at anything that we can do on a community level to support parents will benefit children. So living wage, affordable, accessible childcare, emergency paid leave, those are crucial as it relates to exposure to life adversity of intimate partner violence.
Great. Carrie, how about you? What's something you're excited about?
Emily Miller is our new Green Dot coordinator on campus, and she is an absolute rock star. She is bringing Green Dot. Jasmine Brooks, our previous Green Dot coordinator, also was a rock star. We've been really lucky with getting these phenomenal humans building up the Green Dot program on campus. You'll see it everywhere. You'll see it on police cars. You'll see it on athletes' gear sometimes. You'll see it all over the place. So that saturation point, looking at from a public health model, that appropriate dosage of the information, they are just hitting that mark so well. So both Jasmine and Emily have done a phenomenal job of really building out Green Dot and having it become part of the vernacular of our student body, so that the students know that it's just part of the culture at Iowa State University, that they have a role to play in keeping our campus as safe as possible, and they have a role in preventing the violence from occurring.
Malai.
I'm going to take a look at it from the kid lens because that's the only lens I can use. And so I would say I'm just really excited about trauma-informed care toolkits that are being provided to teachers and to schools and to administrators within the schools and spaces where we see our kids. And so just, you know, more awareness. The Iowa ACEs 360 report just came out. There's a lot of great resources that are associated with that. Please Pass the Love is another organization's really amazing supportive resources, and there's just lots and lots of other community-based organizations that are providing our providers in our nonprofit sector with the traditional sector. So public health would be one space. Our doctors, nurses, hospitals are being informed of ways that they can provide supports when they're engaging with families, and then our schools as well. And so I'm just really excited about the collaboration that I see happening with resources that are just so essential for the community.
Awesome. Before I wrap up our conversation, I just want to give each of you the space. Was there anything that you wanted to touch on or say that I haven't given you the chance to talk about?
I think between the three of us, we could be here until about 10 o'clock at tonight. If you leave it too open, I can see everyone's eyes are bubbling a little bit. There's so much more I want to talk about. I would say for myself, the relationship between social justice and intimate partner violence are so intertwined. So for folks to be paying attention to that, of when folks in marginalized groups face additional risk, being mindful of the social justice movement is deeply, deeply rooted in the work that folks are doing to prevent intimate partner violence and domestic violence.
I appreciate that. I'll bounce on that a little bit and say that, you know, we're all in a pandemic. We're on this Zoom call together, socially distancing, and we've been under some stressful conditions. And I think what we've noticed is how COVID has really amplified some conditions that were underlying in our communities that we didn't know about. And so something that I would throw out is just to be really mindful, give each other grace and space, and check in on each other as humans, and really, really, really check in, not just ask, how are you, but maybe ask a couple follow-up questions so that we can really be supportive of each other in our communities.
Yeah, and just in closing around programming, intervention, activities, opportunities that we're all working towards. Regardless of what program, activity, policy change that you choose, making sure that when you're engaging with folks, you're doing it from that trauma-informed space, the healing-centered aspect has to be incorporated. If you're someone who's working to try to reduce tobacco use amongst adolescents, are you engaging in conversations in that community that address the core adversity, or just trying to stop the behavior that's coping with the adversity? So look to your local partners, reach out to other individuals in your community who can provide collaborative support to be able to say, well, how are we providing mental health supports while we are engaging with low birth weights in our county? How are we addressing economic supports? How are we verifying that people's needs are met, going from Maslow's hierarchy of needs? If people are struggling with housing, food, economics, they're not going to be able to successfully complete a program required to gain access to resources that they need. So in thinking about what you can do, think about, is this through, if we're looking at it through a public health approach, is this an individual level? Is this a relationship level? Is this a community level or societal level? And think about who would be your best collaborators to support that. And just going off of Green Dot's wonderful. That's a wonderful bystander intervention on the relationship level. It is known to be effective, and it's wonderful to know that we have that in our state. We also have that over at Waypoint in Cedar Rapids. And so there's so many functions of that, and thinking about how we can work together. And every single person who comes to the space to say, I want to prevent this from happening. I want to improve how I respond to this. Yeah, continue working together and move from a place of acknowledging that healing is a process. And when someone is coming to you as a friend or family member or service provider and saying, this is what I'm experiencing, you know, believe them and support them and acknowledge our shared experience as people. So thank you for hosting this, Courtney.
Yeah, thank you all for coming and for your time and energy today as we talked about domestic violence through a public health lens. And thanks to everyone who tuned in and watched our live with us and over the past month for our whole Domestic Violence Awareness Month series. That's all we had for you today. So thanks everyone. Bye.
Thanks.
Thank you. Bye.